So welcome once again to the information session about VIA's Exploring Healthcare program. So for the summer, the dates are August 7th through the 13th, 2022. So first I wanted to tell you a little bit about VIA as an organization. So we are a nonprofit or not-for-profit organization that was founded at Stanford University in 1963 as Volunteers in Asia. So we began by sending Stanford students and American college students to different Asian countries to do volunteer work in Asia. And that's why the name of the organization was Volunteers in Asia. But starting in 1977, VIA started providing programs for students from Asia to come to Silicon Valley. And so since the 1970s, VIA has been doing bilateral, so sending Americans to Asia and then Asian students to the US. And we are based in the San Francisco Bay Area. And currently we have 7 current staff members and over 10,000 alumni around the world. So once you join a VIA program, you're connected to the many other alumni that have joined our programs. And this is more like pre-COVID. We have had programs in the US, Indonesia, Japan, Myanmar, Thailand, and Vietnam. But currently, our programs are held virtually, and this upcoming VIA program for the Exploring Healthcare program will be held virtually as well. So that's a little bit about VIA as an organization, and we're really invested in cross-cultural learning experiences. And then a little bit about the Exploring Healthcare program, which is the program that I will tell you more about in greater detail. So it actually started as a collaboration with Tokyo Women's Medical University and Tokyo Medical University in 1996. So we are actually celebrating 26 years this year. So this program predates my time. And so we have a long history of running this program. And so over that time, we have had over 800 students from different universities in Asia studying in various healthcare fields join the EHC program. And during the program, participants explore issues related to culture, society, diversity, and innovation in the context of healthcare. And before the pandemic, this program was held in person in Silicon Valley. But as of spring 2021, this program is being held virtually. We are hoping to be able to offer the in-person program again next year. But for now, it is held virtually. So I wanted to share with you first some learning objectives of the Exploring Healthcare program. One is that participants will critically examine healthcare systems in the US and Asia. This is an opportunity for participants to compare and contrast how healthcare works in the US and in your home country. Another learning objective is for participants to explore unique medical issues faced by patients from diverse backgrounds. And in the US, for example, we have patients from all kinds of different backgrounds. And so being able to work with people from different racial backgrounds or ethnicities, cultures is critical to being a healthcare professional. Another learning objective is that participants will discuss the intersections of healthcare and social issues. Basically, we'll be using healthcare as a lens to explore related social issues. And COVID-19, the pandemic, will also be one of the things that we'll explore. And the different social issues that the pandemic has illuminated will be explored during the program as well. Another learning objective is for participants to gain insights and mentorship from a wide variety of healthcare professionals. During the program, you'll get to meet not only physicians and nurses, but also social workers, chaplains. Chaplains are people who provide spiritual care, and other types of healthcare professionals as well. And then finally, participants will reflect on the kind of healthcare professionals they want to be and expand their network. So many participants are interested in joining the program because they want to expand their international network of healthcare professionals. So these are the 5 main objectives of the Exploring Healthcare program. Now I wanted to share with you what a day of virtual EHC looks like. So this is Asia time, but basically in the morning, we will always begin with some kind of icebreaker or energizer activity. And then we will have a guest speaker or a panel discussion, panelists. They're all based here in the US. And so you'll get different insights on a variety of topics. And then in the afternoon or late morning or early afternoon, there will be time for discussion and reflection with fellows. I'll tell you a little bit more about fellows in a moment. But this is an opportunity for you to practice sharing opinions in small groups and reflect on what you learned. And then in the evening, so on your own time, you'll be invited to share a reflection, write an individual reflection for the next day on the online platform. You'll learn more about that once you actually join the program, but we will be using an online platform to share resources, and there will be a discussion forum as well. And then there will be optional activities, all done virtually, of course, to build connections with other participants. So this is what a typical day will look like. In terms of, you might be wondering, okay, what are the topics that will be covered or who are the guest speakers? So guest speakers and panelists can include current medical students at Stanford University and other medical schools in the US. We'll also have former EHC fellows. So fellows play a leadership role during the program, and they're typically either alumni of the EHC program or American medical students. Guest speakers also include organ recipients and family members of organ donors. So if you happen to be interested in organ transplantation, that's a unique opportunity to hear directly from recipients and donor family members about their experiences. And then, as I mentioned earlier, you'll have a chance to meet a variety of healthcare professionals, from doctors and nurses to social workers. And on this image here, there's other topics that we have covered in the past. So each program, we try to introduce new themes so that we keep the program fresh and relevant for each time. So that's to give you kind of an idea. But organ transplantation has been a topic for the program for many years now, as well as palliative and hospice care. Work-life balance is another important theme that we'll explore, medical education. But again, the themes do vary from program to program. So this is a sample schedule. So basically, before the program begins, about a week before the program begins, there will be an orientation and an English support session to give you an idea of what to expect during the program, and then to give you some tips on how to successfully complete the program and give you tips on completing it in English. Because many participants may have anxieties around completing the program or speaking in English. So that English support session is designed to ease your anxiety and build your confidence. Again, this is a sample schedule, so the exact schedule for the summer may be different, but day 1 might be medical education, day 2, healthcare disparities in response to COVID-19, work-life balance, day 4 might be disparities in healthcare, day 5, organ transplantation, day 6, palliative care, and day 7, mental health. Okay, so one thing I wanted to mention a little bit more is the fellow groups. So essentially, when you join as a participant, you'll be assigned a fellow. And so whenever there's time for small group discussions, you'll gather in your fellow group. And the fellow will help you reflect on the day's activities and share ideas and summarize key insights. And in your fellow group, you'll get a chance to practice speaking and discussing a variety of topics in English. You'll also get to strengthen networking skills, and you'll have a chance to do one a group project, which is to write follow-up thank you emails to the guest speakers and panelists. And then being in a fellow group, you can also build friendships, especially with the people in your group. So as you consider, as you learn about the program and think about if this is the right fit for you, it may be good for you if you have a busy schedule and are looking for something with less time commitment and more flexibility than an in-person program. A virtual EHC might be right for you if you want mentorship from peers and a variety of healthcare professionals without traveling far. It might also be right for you if you want to discuss a variety of healthcare topics, including COVID-19, related social issues, and current events. Virtual EHC may be right for you also if you want to form friendships across cultures and you're excited to use English, regardless of ability level, to exchange ideas and explore the future of healthcare. One thing I wanted to mention right now is that we don't expect perfect English. So if you're nervous about English, that's totally normal. And many participants often start off feeling nervous, but they build more and more confidence throughout the program. Okay, so now I'm going to stop sharing. And basically, we are joined today by two alumni of the program. One is Yuri Sudawara. She joined actually our very first virtual program in spring 2021. She is also a fellow for the upcoming summer program. We're also joined by Tomyat, who was an alumni of our most recent spring program, so just a little over a month ago, and he will also be a fellow for the summer program. So I've invited both of them to share their experiences as a participant. So for those of you listening in, I hope that hearing directly the voices and experiences of two alumni will help you decide whether this is a good program for you. And so without further ado, what we're going to do is kind of an interview or informal discussion style. So I'm going to ask some questions and invite Yuri and Tomya to share. Okay, so the first question for the both of you is, did you hesitate at all to apply to the EHC program? And if you did hesitate, what made you hesitate? So, Yuri, would you like to go first?
Me?
Yeah.
Okay. Yes. First, I really hesitated to apply for this program because I'm not a native English speaker, so I'm really anxious and nervous about speaking English. Maybe as well as many participants. And so, but I thought if I give up this right now, I will regret it from now on forever. So I decided to apply for this program. But the biggest problem in my case is the linguistic ability. And yes, that is my biggest concern that time. How about Tongyan?
Yeah, to be honest, I didn't hesitate to join when I like get the information about the program. I join like the information session like this before my program, and then I really interested in some topic that I never ever had before, and I really want to know this. And also I want to like get experience of learning together with international students trained by international a professional from international like university or field. So yeah that's about me.
Yes, thank you. And also, I should mention that Yuri is currently a fifth-year medical student at Oita University in Japan, and Tomya is in Myanmar, and he is in his final year of medical school. So I just wanted to share that context with you. And also that for the participants or anybody who is interested in the program, each time the cohort, the where the participants come from varies. So we often get participants from different countries or different medical schools join. So if you're interested in networking and getting to meet people from different backgrounds, this is an opportunity to consider too. So going back to our interview style, so Tomya, you didn't hesitate at all to apply to the program, but Yuri, you had
really?
but Yuri, you had concerns about mainly around your English, and so I'm wondering if you can tell us what made you decide to apply ultimately. Like, what made you decide that, despite your concern about English, like what made you decide to apply and join?
I just didn't want to regret. So if I gave up that time, I would lose this chance forever, and that was not my ideal situation. So I was really so nervous and anxious, but I encouraged myself and just try it, jump in this station, and so the result was really good, and I was selected, and I could join this program, and really I appreciate Lina's kindness. Lina really tried to understand what I was saying in the interview test, and that's really so helpful. Yes, that's my answer.
Yeah. Can I add something?
Sure. Yeah.
Didn't hesitate doesn't mean I'm not well worried at all. I have some worry about that, like especially that English matter. English is like the second language, like many Japanese. So I have some concern about my English, as my English wasn't very good at the time, and as I said with Lina before, I have some like bad experience of learning with some international student, like don't understand what they are saying because they are speaking too fast and like with their accent. So I'm a little bit concerned about that, but like I have to try, and also I want to participate. So and also I get some support from English support session, and also the learning environment is, as I mentioned in the feedback of the program, this is like stress free, supportive, and like you can say whatever you want, and then you might you will get help not only from the organizers and fellow but also from the peers. So yeah, it will be like pleasurable learning environment. Yeah. So
Yes, it's completely the same.
yeah.
I love that. Thank you so much for sharing that. So I wanted to ask you as well, how did you feel about joining an online or virtual program? Did you have any hesitation about joining an online program, or how did you feel about that part?
How about Tomya, please?
Yeah. Okay. To be honest, like virtual program is no way to become as good as outside program. Everybody know that, but for me personally, I becoming used to it, like the virtual program, as I'm joining another 1 year program in our country. It's also a virtual program. So yeah, I'm just fine with that because I can share, I can contribute, I can learn, and I can do everything except seeing my peers and classmates in person. So um, yeah, no, not much hesitation, but because of the situation, right? The diseases, and also in the case of our country, it's not as safe as before. So at that time, virtual program is the best option for me. So I don't have no much hesitation about that. Yeah.
Thanks so much. How about you, Yuri?
In my case, to be honest, I really want to go there and meet you in person, but it couldn't be. And so, but there is, some good point in virtual programs. Like, we don't have to move somewhere, and what we have to do is just opening our PC in my room, and it's really so useful, and we can use our time very effectively. And that is the good point for me. And also the duration of the program is shorter than the previous one, like in-person program. Usually we have 1 month program, but we have only 1 week program. And actually in Japan, especially in my university, we don't have a long vacation during summer or spring. So it is really so hard for me to join such a long-term program. And so the shorter duration of this program is also helpful with me. Yes.
Yeah, thank you for that perspective. Yeah, I think I have also realized that there are actual benefits to doing the program virtually. And um, I think it's important to think about the in-person and virtual programs as kind of two separate programs, because it's hard to compare because it's very different. So, but thank you for sharing your thoughts on that. And then another thing I was wondering about from both of you is how do you think the program, the EHC program, has benefited you personally or professionally?
For me, please forgive me because of my some background noises. um, Personally, like it improves me a lot, like many parts. First thing, English. Um, uh, like it can be said that it's a kind of place to practice or improve our like speaking skill, like and also I gain much confidence to share about my experience or to ask question to the respective guest speaker or organizers, and also network. Before that, I didn't have much network. So I have to meet with many international students from um, Japan, and also sorry, give me a second. So noisy. And and also like get some experience and like the knowledge on what like, because the guest speaker contains the medical student from many famous university, so I get what how they are learning, what difficulty what that they are facing. So and the network, and the final thing is management because our country is suffering so much struggle at the current time. So I have many problems regarding internet issue, electricity issue. So um, I have to manage so many backup plans to be able to participate in that program. So I improved management skill a lot. That's a personal skill. And for the professional one, as I'm a medical student, and there are many topics that I learn. I have learned many topics that I have never had heard before. That I mentioned before, like some topics such as like palliative and hospice care, and like organ transplantation, and then some kinds of disparity in getting healthcare, like in US. I haven't heard that before, and when I had that, I'm really surprised. So for professional aspect, I get many ideas and knowledge that will be very helpful throughout my career. Yeah.
Thank you, Tommy.
So in my case, personally, I I got the connection with peers, members, and other alumni, and you know, we could build up friendships and good relationships with peers members, and they are um some of them have connection with Japanese um people like Lena and other members, but some of them are from different countries. Like Hinda came from France, I think, and other ones are from United States, of course. And so I really wanted to build up such a international relationship among them. So that was the biggest thing I got in this program. And even after becoming a doctor, such a network is very useful to create our own careers, not only our careers, but also such a friendship is very helpful, especially when you want to work in the United States or other countries. I and this is just my personal feelings, but I really love BS members because they are so gentle and kind, and whenever talking with them, I always feel like really so relaxed and relieved. And so I'm so delighted to have such a good relationship, even after um ending ending up such a program. Even after the program, you could join some beers even many times. So that is my pleasure. And so that is my personal benefits. And about my professional benefits, actually I'm still a medical student, so not sure, not clear about professional benefits from this program. But um, so through this program, we could learn an ABCO mentality. Maybe you are thinking, what is it? A is active, B is brave, C is curious, and O is open-minded. And it is very important mentality in this program. And it's very useful, especially when you you give some presentation in front of some people or speaking up or something like that. And so getting such a mentality will help me to give some presentations in some conferences after becoming a doctor or something like that. So that is my professional benefits from this program, I think.
Thank you, Yuri. And thank you for mentioning that ABCO mentality. That is something that I definitely try to invite everybody to embrace during the program and even beyond. And I think for this, like especially the being brave part, again, for many participants, English isn't their first language, and so it can be scary to share ideas and communicate in English. But we try to create a supportive. Tomiat used the word stress-free or relaxed. We do try to create that supportive environment so that you feel you don't feel so nervous when speaking up. And as I mentioned earlier, we're not looking for perfect English. So in combination with that and the supportive environment, we really truly hope that you'll grow more and more confident in your English. Thank you, Yuri. And thank you, Tonya, too. So this is a related question, but I'm also wondering if you can tell us what is something you learned from the program that you use today or even like right now? Like, is there something that you learned from the program that you're applying on a daily basis or regular basis?
Um, as I said before, I am joining some leadership program in our country. It's more related with liberal arts, but it is contains some courses that related to health, and I take that kind of course because I want to learn like that the field that's familiar to me. So and at that kind of class, I have to learn and discuss about some topic that I learned in this EAC program. So like some kinds of healthcare disparity, and um, in our country there's not much serious racism. So our people from our country are not much familiar with the term and that kind of disparity. So they are very strange to them. And like I at the case I can discuss well, and I have many knowledge about that disparity, especially like in the US context or in the Africa or something like that. So I can participate well without searching for many sources on the online. So that's the one. and and also the things that is not present in our country is that palliative and hospice care. And so I haven't had it before. So um and I got to know the importance of that hospice care before a person die. So uh I did experience that situation because my friend's brother unfortunately passed away because of cancer at his young age, and I have to like console her and also like uh, give some help relating with that hospice care at the final stage. So like I think it is like applying the knowledge from that um, EHC program in my daily life. Yeah.
Thank you so much. I love that you're kind of being able to, especially being more knowledgeable and being able to discuss the disparities in with different people. Yeah, that's great.
Yeah, actually, I'm so curious about your leadership learning in your university, and I want to ask you later.
Yeah, I'll explain it later if I got some time. Yeah.
That is so cool. Envy you, but just let me speak about my case. So in my case, as I mentioned earlier, the ABCO mentality is the biggest one, and through this program, I got more confident about my speaking English, and my English is not perfect. And so I'm still feeling really nervous, especially when speaking English in front of many people, like this situation. I'm still so anxious, but I think I could more confident about it before joining this program. And so after this program, actually I joined another virtual program that was held only in English, and the students came from some European countries like Italy and other European countries, and the teachers um, also came from really different countries, and especially most of them were from maybe European countries like Italy, Spain, and something like that. And there's no person like Lena who can speak Japanese or who can understand Japanese. And so my anxiety was the highest level. But I just want to try it. And so I jumped in it again, and I could complete it. And so through this experience, I could get more and more confidence. And that is the biggest thing. ABCO mentality is the biggest thing. And also, I could learn the difference in medical system. medical care system between the United States and my country, Japan. And actually, such a knowledge about the difference in medical care system is very useful, especially when you are reading medical articles or papers or something like that, because the measures or the ways of analysis is a little different from the United States and in my country, Japan. And if you don't know that reality, you cannot get the correct results. How to say, you cannot figure out the results correctly. So knowing such a difference is very important, not only as a medical student but also as a doctor. So in such a points, I think this program is very useful for us.
Thank you so much, Yuri, for sharing that. And I'm glad that you're taking away the ABCO mentality. That makes me really happy to hear. And then another question I wanted to ask you both is, which session from the EHC program was most memorable for you?
We got many different kinds of session, right? Like guest speaker session and
right.
Like knowledge sharing by some expertise, some like other student from university, and then game session and some kinds of knowledge sharing session and recommendation by fellows and organizers. So many different sessions, but most memorable is just like at the last day. Like we are so much sad because at that day we will leave from everyone from the program. So like I remember one of our classmate is me from Japan. She even cried, and she can't she can't even stop crying. And like we always said, and it's the most memorable day for me. And like at the day we learn about our mental health, and so it's a little bit relatable, and like that's the most memorable for me. And yeah, and I also um never forget um the newer knowledge uh that I get from the EAC program. So these are the things that I most memorable things from the program. Yeah.
Thank you for that.
Okay. In my case, I remember organ transplant session very clearly, because I could learn there is a difference among races, like black people or white people, Asian, Hispanics, and actually I was so shocked to see that someone can get the transplantation earlier, but somebody cannot because of their skin color. And that was the shocking point in my mind, because in Japan, there is, not so many racism problems. Like most of them are Japanese, and um, other black peoples or white peoples, a kind of a minority. So we couldn't come up with such a problem in my country so often. But in the United States, I could learn there is such a problem as a a daily problem. So there was like a kind of a culture shock for me. And the other one, I remember life work balance very clearly also. And so before joining this program, I thought the United States is taking an advance in such a field. Like, for example, I will be a female doctor, but I can go to work and my child can be taken care by my mothers or something like that. And there in the United States, I imagine that there is a enough system for child care, but the reality is the people are suffering from almost the same thing in Japan, like on how to take a risk without feeling guilty or something like that. And that was the really fresh and new new find new finding in my mind, and we could exchange our frank opinions about our work-life balance with my peers and guest speakers, and that gave me a chance to rethink about my own work-life balance, and so that's really memorable for me.
Thank you, Yuri, for sharing. And then my last question to the both of you is, what piece of advice would you give to anybody who's unsure about applying to the program? Is there anything that you would want to say?
To say it overall, like in one word, about the program, is like for me, it's worthy enough. And then if you are unsure to join the program, so please consider what's your concern. And I think we both, me and Yuri, share our experience and what we have learned and what we have gained in the EHC program. So compare with it, your concern and the thing that you are expected to get from the EHC program. And so, as I said before, for me, it's worthy enough. And you can get many things. Not only the knowledge about health, but also some social things, networks, like soft skill. So and also friends network. So like it's like a lot. And yeah. So to conclude, find your concern and compare with the expectation. And if you think it will be like as I said, it will be worthy, just do it. Yeah, I can't say many complicated ways, but I'm a kind of straightforward. So yeah, yes, it's my suggestion. Yeah.
Thank you, Tanya. How about you, Yuri?
Okay, I think Tanya can share the most of the necessary things. So I just want to suggest, if you are interested in this program, I really want to suggest really strongly you just try it. And if you give up here, you will regret forever, like or why I didn't do that or something like that, and that's really sad part. So I really want to suggest, and I really want to know. No, I know it's really so challenging for us to jump into that unknown situation like this program or something like that, but it's much better not to try it. So please jump in here, and we are very welcome, and we are waiting for you, and really looking forward to learning medical care with you. And yes, welcoming you. Really want to welcome you as one of the members. So that is my message.
Thank you, Yuri. I really appreciate that. So now I just want to go back to the presentation and share a few more logistical details about the program. And then if anybody in the audience has any questions, you're welcome to ask. So let me go back to sharing my screen again. Okay, so I wanted to share with you that the program fee is $900 US, and what that includes are the following. There's a 3-hour pre-program English support session on Saturday, July 30th. The fee also includes 30 plus hours of live online presentations, discussions, and interactive workshops, access to an online learning platform with additional information, resources, and opportunities to connect with peers, mentorship from peers and experts, as well as topic-specific English resources and opportunities to practice English in the context of healthcare and social issues, and building friendships across cultures. And in terms of requirements, so to have a successful program experience and receive a certificate of completion at the end, participants should have reliable internet access and quiet space to participate in the live sessions, be able to use Zoom on computer or mobile device with a camera, speakers and microphone, or headphones with a microphone, actively participate in all online sessions and contribute to group activities, and complete all required activities on the online platform. So those are the requirements. And I wanted to share the timeline for the application. So there's 2 rounds in terms of deadlines. It doesn't matter which deadline you apply by, but if you apply earlier, you'll more likely to make sure that you have a spot. But the round 1 deadline is May 16th, and round 2 is June 13th. And then if you apply by the first deadline, then you'll have an interview in English via Zoom with me sometime between May 17th and 27th. If you apply by June 13th, then the interviews will happen the week after. And then if you're accepted, then the acceptance letters will be sent by email by May 28th or June 25th. And then you'll confirm participation by June 11th or July 9th. So there's still plenty of time for especially for round 2, but even for round 1. So as you consider everything that you learned about the program, if you want to apply by round 1, that's great. But if you want to wait until round 2 deadline, that's also okay. And then, so what's next? So if you are now interested in applying to the program, which I hope you are, then I invite you to start your application. The application link is here, and it's in the QR code. And maybe Hinda, would you put in the link in the chat as well? And then also, if you have any questions, you're welcome to email me. Here's my email address. I'll put it in the chat as well. And you can email me in English or in Japanese. So before the program, I'm happy to communicate in Japanese if you have specific concerns or something. But during the program, I will entirely speak in English, unless there's some, of course, again, something that happens. But in general, I do try to make sure that I speak English